Welcome to the Future of Dentistry podcast. My name is Allison here, your host. I'm here with my amazing guest, Autumn Henning. Thank you so much for coming to the Future of Dentistry, although I am in your town right now in Greenville, and we're going to explain a little bit about what we're doing in a little bit, but I want to welcome you first. Welcome to the show.
Thanks so much, Allison. Happy you're here. Happy to be on the podcast. So
absolutely. We're excited to share who you are, what you do, and how you help the dental industry, because you are not actually in the dental industry per se, but we're going to talk about how what Autumn does is actually fundamental for the dental industry. So Autumn, introduce yourself to everyone here.
I like to say I'm an adopted dentist.
Mm-hmm.
That's what I'll say. So I am a speech language pathologist and a certified orofacial myologist and an international board certified lactation consultant. So
say that 3 times. Say that 3 times fast.
Right. So essentially what I specialize in is orofacial function and more so dysfunction. And so, looking at the mouth and all the jobs our mouth has, eating and talking and feeding and all of those things, and how it affects our entire health, our sleep, our posture, the TMJ, things like that. And so that's what my job is. So I see from infants all the way up to elderly. So I could have a baby having breastfeeding difficulties, and on the other end of the spectrum, an adult with sleep apnea. Mm-hmm. And so everything in between, headaches and picky eating, kids with speech disorders, all of those things. So really, I look at how the lips, the tongue, the cheeks, the jaw, how they all work together or not, mm-hmm. And figure out what are those contributing factors. So a lot of what I do is very collaborative, working with dentists primarily, mm-hmm. and pediatric dentists, general dentists, orthodontists are the main ones that I typically collaborate with.
I love it. I absolutely love it. And I actually got to meet Autumn through one of my friends who's a pediatric dentist, because Autumn came and took my Instagram course, and she just took off. Best student ever. You crushed it. Don't tell anyone else that you were the best student ever, but truly, she just took the information and started educating her patients, which is exactly what we want to do. And so one of the reasons why I wanted to have you on the Future of Dentistry podcast, because I think in this podcast, we're talking about what is happening in the dental industry, how it's evolving and changing to better care for our patients in a preventative way. So our patients want things faster, easier, and safer. They want to really focus on prevention. They want to focus on solving problems before they're problems. And I feel like your role is absolutely critical in that ability to prevent these problems from happening in the future. And so tell us a little bit about how you collaborate with your dentist, with your pediatric dentist. Like, why is it so important that you guys work together to solve these problems?
Right. So at its crux, I would say, everything that you're looking at in the mouth and seeing in the mouth, there's a reason for it. And there's a root cause behind it. And a lot of what I do is related to that root cause. And so you can think about someone with sleep apnea or bruxism, right? And they're destroying your whole mouth restoration, mm-hmm. over and over again. You make them 10 bite guards and it's not fixing the problem. Mm-hmm. So that's kind of the role that I'm playing is, looking at that tongue function, that oral rest posture, the balance of the muscles and the jaw and things like that. So yeah, I would just say, really zooming out and looking at the whole body and the whole patient. We learn things when we learn about the body in systems, mm-hmm. and, everything's interconnected.
It really is.
So working alone, that doesn't get great results. Mm-hmm. And so, structure and function have this dynamic relationship. If you're seeing high narrow palates, that's likely because of mouth breathing or a tongue tie or poor tongue rest posture with the tongue not up in the roof of the mouth. And so, as a dentist or orthodontist, you can definitely expand that palate, but it's not addressing the reason we got there in the first place. Mm-hmm. And who knows about the stability of it. So yeah, just, definitely working on the functional side and then collaborating on the structural side.
Absolutely. And it's really looking at the patient like a whole person, like looking at everything involved. And often we can't do that alone. Like dentists can't do it alone. You can't do it alone. And that's where the beautiful collaboration comes in to be able to provide that best care for the patient. And so something that I've been hearing a lot in the industry, and a lot of groups and organizations are talking more and more about this, but not everyone knows how to get it started, and they don't know how to start collaborating.
Yeah.
And so if you could tell a dentist that's thinking about collaborating with someone in your specialty, how would you suggest, or like what information can you tell them in order to start that pathway?
Right. Yeah. I would, see if there are any patients you have in common, or a patient in your dental chair that has speech issues. Ask if they have a speech therapist, or, and then reach out to them. Like, we're nice people, I promise.
Yeah.
Reach out to us. Say, hey, could I come observe in your office and see what it is you do? Would you like to come to our office and see what we do? And then meeting of the minds, have coffee, have dinner, and just get to know each other and your philosophies. I guarantee you'll find dots that you can connect and ways that you can enhance each other's practice to help your patients.
I love that. And so what are you typically referring patients to dentists for, and what are they typically referring to you for?
Yes. So typical referrals to dentists, pretty much, malocclusions, cross bites, high palates, narrow palates, sometimes jaw surgery. That may be part of it. Airway stuff, to get imaging and cone beams, or an MRI of like the TMJ, and then tongue ties. That's a big one. So
Yeah.
those are primarily the ones. Again, I'm in someone's mouth every day. So, if I see something interesting that I don't know what it is pathology wise, I'm definitely gonna refer to a dentist for that.
Amazing.
So those are the main things that I'm referring for. And then on the flip side, I think dentists are doing a great job, up and coming, and looking at the whole picture, and they're asking those questions on their history forms about snoring and about speech issues or feeding issues, or, headaches and TMJ and things like that.
Yeah.
And so those are what my referrals are coming through to kind of see if there's a functional component to it.
That makes total sense. Are you seeing any trends, like with what's happened with the pandemic? Are you seeing I'm imagining increase in stress causes some things that you're seeing. So I'm curious, what any trends that you're seeing?
Yeah, it's interesting. A lot of times, people have said it really started with the pandemic. And there's a phenomenon out there that I read about called mask mouth. And basically, when you're wearing a mask, a lot of people are mouth breathing. And so that causes stress on the joint, and, changes to the dentition and things like that. So yes, I also find that people tend to kind of rationalize things for stress. Like, oh yeah, I grind my teeth because I'm stressed, when oftentimes it's related to breathing. So yeah, it's been an interesting time for sure.
I can imagine. Yeah, it's interesting to hear, in every different kind of zone of genius in the profession, is what are they seeing because of the pandemic and because of the stress. This is something I just continuously hear over and over again. It's like the patients are suffering more and more because of stress. So it's good to know that there are these resources. And speaking of resources, I know that one of the things that you wanted to make sure that I mentioned in this podcast was, what resources can you give to a dentist in order to find out information, to connect, to refer, to collaborate? What resources would you want to make sure that everyone has?
Yeah, so to find one of us, so orofacial myologists are kind of few and far between. We're working on that. But it's kind of like another master's degree in our field. So definitely the IOM directory to find an orofacial myologist. I love ASAP pathway, airway, sleep and pediatrics pathway. That's led by 3 general dentists looking at sleep and pediatrics and sleep disorder breathing type stuff related to the mouth. Those are two really great resources. And then shameless plug, I do teach courses and dentists come all the time. It's really fun. I teach TOTS training, tethered oral tissue specialty training. And then the reason you're here this weekend,
Greenville.
Dr. Ann Bynum and I teach our second level course called Plot the Tot. And it's really about working on integrating this holistic care into your practice as far as tongue ties and, screening for mouth breathing and myofunctional disorders.
I love that. And I'm so excited to learn everything you guys are going to teach us this weekend. It's going to be so fun. I already know we're going to learn so much. What would you say if a dentist is listening right now, or a dental office manager, a dental team member, and, this is something that they've been thinking about implementing in terms of screening or in terms of really trying to create the solutions for what they're seeing in a different way. What would you say would be kind of like the first step? Like, where would you say they should start? Where should they go?
Yeah, I mean, I think, continuing education, conferences, work smarter, not harder. Have, just a checklist of yes or no, and ask some of these questions. And if you see a lot of checks on the yes side of the column, then to have that conversation so that, it's not extra, it's just already part of your intake process. Is what I would say.
I love that.
Some great books that you could read to start with. Gasp by Hendon and Gelb, Tongue Tied by Richard Baxter, Airway is Life by Dr. Meghna Dasani. Yeah, so those are some of my favorites.
I love it. I absolutely love it. And so if people want to learn more about you and where they can find you, if they have questions, if they really just want to reach out to you, where can they find you?
Sure. So my practice and company is Chrysalis Oralfacial, ChrysalisOralfacial.com. There's a contact form on there. You can find me on Instagram and Facebook as well. So
definitely check her out on Instagram. Again, like, she crushes it. She's face to camera, educating, teaching all the time. It's so good. So definitely check her out on Instagram. And my final question for you is, if you could kind of paint a picture of the future of dentistry to be like the most collaborative, or the most, I guess, the best way that we can take care of our patients, what would you say would happen in the future of dentistry, utilizing the collaboration that you guys really create together?
I would say, there wouldn't be just dental practices. There would be whole centers, and integrating some of the other specialties like myofunctional therapy and, even ENT, things like that, sleep physicians to work together. So I would love to see like complexes pop up, like you have a medical complex and there's like unrelated fields. It would be nice if there were, related fields together and we could collaborate easier and more in real time.
Exactly. And how far do you think we are in terms of the collaboration? Like, do you think that we're just starting to toe the line in collaboration, or are we, moving along?
Yeah, I think there's just a lot of challenges as far as, I think the biggest part is not actually the collaborating, it's the communicating and doing that in a manner that, doesn't take up so much time. And so I'm hoping, in the next 20 years, we start to see a change. That's usually how long it kind of takes. But, I kind of got into this area of my field about 10, 12 years ago now. And I've seen it come leaps and bounds in just these few years. It hasn't really been that long. So I think it's getting more common because people are seeing results.
Yes.
And that's what matters.
Absolutely. And so this is something that I was really excited to ask you and this will be my final question, because I could literally just pick your brain all day, and I know I'm getting a full conference from you tomorrow, so I won't be selfish, but what are some of the most exciting, rewarding results that you see?
Oh my gosh. Yes. It's so exciting when, there's this mutual respect. I think in our society, we think of like doctors and other healthcare practitioners but really, like, we're equals. I refer back and forth and they listen to me and I listen to them and we respect each other. But You know, there was a patient I can think of, and I guess this was last year, that the orthodontist was like, yep, you know, I think she's headed to jaw surgery. And, you know, she sent her over to me to work with her. We did myofunctional therapy, a tongue tie release, and she did like her recall with her and, you know, new scans and all the new measurements and stuff. And she called me, it was a Friday night. She called me on my cell phone and she said, you know, I don't know that we're headed in that direction anymore. And like, that's life changing.
Mhm.
That is so life changing. And you know, that's something, working with moms and babies, you know, moms that want to breastfeed and say there's a tongue tie or some sort of oral dysfunction going on, you know, really having a hand in that relationship, that, you know, shapes their whole life. So yeah, it's really neat getting someone off their CPAP.
Yeah.
That's super cool.
Huge.
Closing open bites just by getting the tongue out of the way.
Yeah.
And in the right spot. So yeah, I love seeing those results and it never gets old.
I love it. Oh my gosh. Well, I want to acknowledge you. Thank you so much for being on the Future of Dentistry podcast. It's an honor to have you here, and definitely go and check out her Instagram at the very least, website, and go and learn more about how she is helping change the dental industry and really creating what the future of dentistry can be. I'm so excited to get your course this weekend. By the time this airs, we'll have gone through it, so I'll have a little bit more to say about it and some of the results that I see, but I want to acknowledge you for everything that you do, your bright and beautiful personality, all of your Instagram game. I'm just so impressed with it. I cannot get over it.
It's all her.
No,
From her.
no, she did it. So thank you so much for being on the Future of Dentistry podcast, and we will see you tomorrow.
Thank you
At the
so
conference.
much. Yes. All right.
All right. Bye, guys.